Hello, good evening to everyone. I am Elango from Trichy. This is the second video of obstetrical and gynecological nursing. So here, so far in the first video, we have seen up to week 24. Now this is week 28 that you can see here. The fetus is 38 centimeter with 1,200 grams of weight. The limbs are well flexed, brain developing rapidly, eyelids open and close. Lungs are developed sufficiently to provide gas exchange, that is called lecithin forming in this 28 weeks. If born neonate can breathe at this time, the lecithin is most important for the lung enlargement and lung maturity. This is week 32. Fetus is 40 centimeter in length with 2,000 grams, that is almost 2 kg. Bones are fully developed, subcutaneous fat has collected in various particular portions. The lecithin and sphingomyelin ratio is 1.2:1. That is most important. This is MCQ type of question. Actually, the lecithin and sphingomyelin is most important for the lung maturity. Understand? This is called surfactant. This lecithin and sphingomyelin is the surfactant, which is very helpful for the lung maturity. And then only the fetus can breathe if the baby is born. So this lecithin and sphingomyelin rate should be above 2:1. If the lecithin and sphingomyelin ratio is 1.5 or 1.9, if the baby is born, definitely the baby may have the problems in their lungs and lungs related illnesses. This is week 36. The fetus is 42 to 48 centimeter length. The fetus is 2,500 grams. The skin is pink and the body is round. The skin is less wrinkled. The Elango is disappearing. The lecithin and sphingomyelin ratio is greater than 2:1. The LS ratio must be 2:1 or above. Week 40. Here, the fetus is 48 to 52 centimeter length. The fetus is 2,500 grams to 3,500 grams in India. The skin is pinkish and very smooth. Elango is present on upper arms and shoulders. Vernix caseosa is decreases. The fingernails extend beyond fingertip. Sole creases run down to the heel. The testes are in the scrotum. The labia majora are well developed in this week. This is about fetal environment. Amnion, chorion and amniotic fluid are the three important factors. When you take the amniotic fluid, this is about 800 to 1,200 ml by the end of the pregnancy. This is MCQ type of question. Take it down. 800 to 1,200 ml by the end of pregnancy. This amniotic fluid acts like a cushion and protects the fetus, allows fetal movement. It maintains the body temperature too. The amniotic fluid is maintaining the body temperature of the fetus and largely of fetal urine. The amniotic fluid is largely of fetal urine. About the placenta, okay, this placenta provides exchange of nutrients from mother to baby, depends on maternal circulation. Thus, getting the nutrition depends upon the maternal circulation. It produces hormones to maintain pregnancy and assumes full responsibility for the production of these hormones by the 12th week of gestation. What is the name of the hormone? Can you tell me, anyone? Students, I am asking you. What the type of hormone the placenta forms? Yes. Tell me. You please and refer and tell me. There is a question for you. Okay. Then large particles of bacteria cannot pass through. Nutrients, drugs, antibodies and viruses can pass through it. So you try to understand the bacteria cannot pass through the placenta, whereas the nutrients, drugs, antibodies and viruses can pass through this. So in the third trimester, transfer of maternal immunoglobulin is usually happen. So the maternal immunoglobulin transfer in the third trimester from mother to baby through placenta. These are all the functions of the placenta. So this is about fetal circulation. The picture shows many things about that. And there's here the umbilical cord, you can say. It contains two arteries and one vein. In this picture, you can see the umbilical cord has two arteries and one vein. Arteries carries deoxygenated blood here and vein carries oxygenated blood, just opposite to the general circulation. The fetal heart rate. The fetal heart rate ranges from 160 to 170 beats per minute in the first trimester, but slows to 120 to 160 beats per minute by term. Important points to notice here: the fetal heart rate is twice the maternal heart rate. If the maternal heart rate is 70, then the fetal heart rate is 140. If the maternal heart rate is 80, then the fetal heart rate is 160. All right. Then so you see the fetal circulation bypass. There are three different types of bypasses are there. Ductus arteriosus bypass the lungs. Here the ductus arteriosus, in the top you can see the arch of aorta, you can see there ductus arteriosus. That ductus arteriosus bypass the lungs, and ductus venous bypasses the liver. Ductus venous in the liver, ductus venous bypass the liver. The foramen ovale bypasses the heart. Here the foramen ovale in the heart, in the upper chamber, isn't it? So foramen ovale bypasses the heart. There are three bypasses which closes at the birth. So present due to non-functioning lungs. Fetal circulation, this bypasses are present for the non-functioning lungs. Okay. So far we have discussed about the different weeks and growth and development of fetus inside womb. Thank you for watching. Thank you.